I'm Dr. Geary, Premier Family Care.
What kind of appointments and medical care should caregivers prioritize for themselves while taking care of someone with Alzheimer's?
Well, naturally, it's easy when you're worried about a loved one and you're spending a significant amount of time taking care of someone. It's easy to put off any of your own health care, and unfortunately, many caregivers have their own chronic health issues that need to be addressed on a regular basis. But it's especially common for caregivers to experience what is known as caregiver burnout, in which people taking care of their loved ones simply don't have enough time for themselves to rest and recuperate. And so I tell people to be proactive about finding help within the family or other community resources that might allow you to take time for yourself to not just go to medical appointments, but to do restorative and relaxing things to decrease your stress level.
What kind of care does a person with Alzheimer's require?
The amount of care and specific interventions for different patients depends a lot on the relative severity and the stage of dementia that a patient is dealing with. Early on, it may be enough to simply make sure that family members are getting to appropriate appointments on time, maybe helping them set up medications and make sure that they're taking all necessary treatments. Overall, there's an increase in supervision that's required to make sure that a loved one is safe, and as the illness progresses, oftentimes it requires a higher level of care either in the home or at a facility that's specifically designed to safely take care of someone and make sure that they get all the necessary treatments and are redirected when they're confused. And it also is important for caregivers to remember that even though some of these needs are very repetitive, obviously their loved one is not trying to be difficult, and this is a part of the process, and so it's important to be diligent with taking care of yourself and reducing your stress level as you handle some of these things again and again.
How has research on Alzheimer's advanced in recent years?
So there's always a lot of ongoing research into Alzheimer's and other kind of dementia treatments, particularly with Alzheimer's. There is a buildup of a certain kind of protein in the brain, which is shown to cause a wide variety of problems, leading to the difficulties that we see with Alzheimer's. And there's a wide range of research going on to try to slow down or stop the production of that abnormal protein in the brain. So eventually, we're sure we'll see some kind of medication or treatment that can halt that process and hopefully nullify these dangerous changes.